24th, which is really hard to believe. And I actually went up north a little bit, and I was impressed to see people in New Hampshire wearing masks, because I'd been up there before the summer, right before the summer, and people were not wearing masks even in stores, which blew us away a little bit on that trip. So if anything, I thought they'd be more lax this trip, but in fact, no, they must have known people that were afflicted. And the mass virus increased 488 less than the week before, so it's 4,003 people. So it is going down. I'll show you a chart in a minute. The number who died went up compared to last week. It's still low, but it's, you know, it's still 97 more people passed away, which is unfortunate. And then USA is about it's 32.93 million people, and I apologize for not being really specific. And that means also there's been a total of 586,793 deaths, and that was May 22nd number. And the 61.3% have had at least one shot in our country, which is a really great sign. So that's pretty cool. Given, you know, all the mishmash during the past year about vaccines and how long it took to get it going in terms of distribution. And then the highest rates for COVID continue to be, I mean, it's pretty remarkable. It's the states that have had it: North Dakota, Rhode Island, South Dakota, Utah, and Tennessee. Now I'm going to show you some other charts before we start our program. You know, I'm on my desktop, and it's interesting. I'm actually having more trouble on my desktop. I'm sure I'm just missing, oh, there it is, okay. So this is the day by day, sort of the track record, okay, of the cases. So if you look at April, right? And this starts on April 18th, and it goes down. I'm using my arrow to May 16th. Look how low. So look how wild it was even in the spring months, not spring months, April for a while, right? Then we had some down spurts, and then we had some up spurts. So it just shows you, you know, in terms of the process, what it's been like, and the process of the virus. But this is not great news for us. This is deaths per rate. And what got me to look at this is I heard on the radio while I was in Maine that they had 893 deaths in the entire state to COVID in Maine. I said, you know, I wonder what the COVID numbers are. And you could see New Jersey, New York, we're number 3. Actually, Massachusetts and Rhode Island are close. You know, if you look at it per capita, 258 versus 255, they're like just 3 behind us. And then you have another couple of states that are close together, right? Very different states, Mississippi and Arizona behind us. And then you have Connecticut, Louisiana, South Dakota, and Alabama all bunched closely. And so it's, you know, some of it makes sense to me, some of it doesn't make sense to me. How much is urban, right? People being close in urban centers that pass it. And California was way down. I don't think it's even showing on the chart. But it's been the death. It doesn't necessarily jive with the virus rates per capita, which I thought was interesting, right? You'd think they would go hand in hand. And then in terms of our world, there's 3 fewer, well, these are the numbers, show you that for a minute, and then I summarize them. But basically, there's 3 fewer viruses this week's report, or past week's 519 report on the previous Wednesday. And there was no deaths. I'm still waiting. I have asked a week and a half ago now for a total number of deaths in the congregate care system. And there's, again, there's not a huge difference here in terms of nearly 2,000 people in congregate settings caught the virus. And the institution's rate of catching the virus was more than 2 times the rate of smaller congregate homes. So it should be of, and I'll fix that before we send that out, but it was actually more than 2 times larger than the smaller congregate homes. Because if you look at these numbers, 1952 out of 8,782 versus 140 people out of 301 that caught the virus in the facilities. So that just gives you an overall feel. So very excited. You know, I don't know what they're going to think of these pictures, but I had choices, and I just went with, ones. Kerry Mahoney, of course, Director of Outreach and Education in the ARC, and she's on here almost every week, and she also co-hosts at least one a month, if not more, and this month it's more. And she, for years, led family support services at the ARC and related services. So, and she's, been with some great colleagues and done some awesome work historically with families and helping agencies be responsive. So it's great to have her on board here. And then Rosalie Edes is the former CEO of Minuteman ARC and Capabilities, and she's former Assistant Secretary at Health and Human Services. And before that, she actually worked in maternal and child health, which is where I first met Rosalie a couple of years ago, I guess, And so she had quite a career. She earned her stripes at public health, and early intervention being a big piece of that. But of course, there's other pieces at public health. Sometime we'll do something on that with Elaine Gavovich. But Tools for Tomorrow, we look to her to help us with this and edit it. And she's done a great job reworking it. And it really, I want to let me share with you the agenda today. I'm going to do a pretty short few minutes on the history of tools and the present booklet. I'm going to share with you really quickly. And then I want to say right now, just to thank Jim and Tina Kirkham, that really the funds to make this happen were in memory of Alec Kirkham. And he died way too young. And, just a lovely family. Jim's a past vice president of the ARC of Massachusetts. And actually, I think for a while lived in Concord. Not I think, I know. So I know Rosalie also, by coincidence, happened to know them. Mm-hmm. And so really, great opportunity for us to be sharing an update. And for years, Diane Huggin would say, geez, you really should do an update on this booklet. And it wasn't really the original tools planning booklet. It was the next piece that helped people adapt it. And so anyway, we'll tell you that when we talk about the history. Then Kerry will talk about Charting the LifeCourse, because what we've done is integrate Charting the LifeCourse into the booklet. Now is something, Rosalie suggested, and Kerry said, yeah, of course, because we've been big time. And then again, this is why it helps to have people who know the field, right? And they're constantly keeping up, right, with the field. And what are some great tools in Charting the LifeCourse? Kerry's talked about on her webinars as well, and the videos that are going on. So it's just coincidence that all this came together, by the way, timing wise too, right? And then Rosalie's going to get into using the booklet for planning. It's great to use when things are going well, but it's also great to use when you're facing barriers in education and advocate. So let me give you a little bit of history. There's the new cover. Now, what's interesting, this is like a redo of the original tools, and we had a whole bunch of people. It was, in fact, let me get off this for a second because it covers my whole screen. And I need to just get off this for a second before I come back to it, because otherwise I won't see my notes. And basically what I want to say is in 2003, 2002, something like that, and we're in 2021. So let's put this in perspective. 20 years ago, okay, we worked in partnership with Mass Families Organizing for Change, the Mass Advocates Standing Strong, the Massachusetts Developmental Disabilities Council, and other folks, but that was the main groups that worked on it. We had gotten a federal grant from the administration on developmental disabilities. And the whole goal was to develop a planning tool that really could be actionable. And that's what we did. And that cover you saw a minute ago was the tool that folks worked on together, and a whole bunch of great people. I'm not going to name them all. And then that led to, hold it, how do we adapt this? How do people use it? And what the goal of the book was, instead of trying to make people fit services, can we make services fit people? And, and that's true today, right? And bringing people together to talk about a vision, a future. And you've heard about this here before, so I'm going to skip to show you the original booklet, which the cover is going to look very different. This is the original booklet, okay? And it was a pocket guide, but obviously that other one looks much prettier, okay? And that booklet, just to give you a feel, where to start, the journey to your vision, and it used the tools book as a piece, but it also got into negotiation strategies. So we really, wanted to then say, okay, when Rosalie and Kerry said, hey, we should really use Charting the LifeCourse, that made imminent sense. And I'm just going to give you a quick feel before I hand Kerry the ball. And you can see how much more updated it is, much brighter. And here's Charting the LifeCourse in the midst of it. And then another piece that was done that Rosalie remembered from the previous round was, when you do work with providers, are there some key questions? Can we give you a tool for that? And this will become posted as well, like an insert type, but it's really not the core of the planning, okay? So that just gives you a flavor of what we're talking about, and I think I'm good. So Kerry, I'm just trying to see. I know you have your own slides, so I'm gonna
Yeah,
let you.
I'm hoping though that you can. I know you couldn't see your notes, but can we show everybody the book?
This book, yeah. Let me go
yeah,
back.
yeah.
I'm sorry. You know what? I thought I was sharing it, and thank you so much for telling me that I wasn't. Here I am putting things up. Did I show them the previous one?
No.
No, you didn't, Leah.
Oh, okay. So let me, oh, no, not that. I don't want to share that. I want to share. Let me go up to the PDF. Now, if I move here, are you seeing the old book?
Yes, that's the old book.
Yeah, so just to feel. So thank you so much, Kerry, for pointing that out. I messed up there. But this is sort of the old, and now you'll see how it looks different. Okay, so this was the old book using our planning tools that we had worked with Ken Keith, who'd flown in from University of California. He, by the way, with Schlaylock and Keith years ago, even 20 years before that, had developed a scale of satisfaction.
Now you're into the new, Leo.
Now it's new. Let me go to the
But you're
top.
in the middle of it. Okay, good. Yeah.
So this is really gives you a feel of how different it is, just the combination of, it's still about planning the good life. We haven't left that. Some things are just lasting, right? Start making your list, putting the vision in writing. Here's part one of the Charting the LifeCourse piece, right? So
right.
Let's go right from that. Then we have the STAR, the integrated STAR, support STAR. And then we have, and I don't know, Kerry, you're going to be talking about this, but do you want me to go through the pages, both of you, just to show people, give them a feel?
Just give them a feel.
Yeah, okay. So I think we did that. And then there'll be resources and, and some scenarios. So you can really look at other people's stories, right? So it's especially great for transition, but it's also great if hey, you know what? It's time to do something else, something more, interesting, challenging in my life, or hey, there's some barriers that drive me crazy. So without further ado, let me get Kerry going then on Charting the LifeCourse, and then Rosalie will follow.
Okay. All right. Can everybody see that?
Yeah.
Yes.
So, Kerry, before you start, could we just mention to people that this is going to be hard copy and also online, and how to access it? Leo, can you?
Yes. It will be online by the end of the day.
And basically all people have to do is type in tools and there'll obviously be an article on it, but it's thearchivemass.org/tools in plural. Okay. Because I think that's what the book says. So that's
right. Yes.
We like to keep things synchronized.
Keep it simple.
Yeah.
Okay. So, this is a little bit about, why this whole discussion about how people get services and what are some of the barriers. And this is a slide we took from our keynote of our transition conference a couple of years ago. And if you look at the graphic in the middle, you're looking at the person and how services really wrap around that person. But when they do that, they kind of exclude family and community. So, and then there's also, there's the workforce capacity, the demand for services, federal budgets, policies, changing demographics. So there's whole reasons why we need to start taking a little bit different a look at how services and supports are provided. So if you look at these three circles, again, it's the person, the family, and the community. And then services, even though it was an intentional, kind of block that family and community. So doesn't it make sense that services are sprinkled as needed on top of the person, the family, and the community. So, you know, we do a lot with person-centered planning here at the ARC. Been doing it for years. You know, as a, you know, I take a lot of the information and referral calls, and I get calls all the time from people saying, what program should I send my son to? And I'm like, whoa, so we got to back up a little bit. And I said, well, wait a minute, tell me more about your son. You know, what are his strengths? You know, what are some of his challenges? What's important to him? How's he best supported? What's a good day look like? So when you look at a person-centered support, you know, you're looking at, you know, the individual that having much more of a voice and his supporters in terms of what a good life does look like. And it brings people together with more of a common experience, people who, you know and love that person. Sorry, my screen is flying all over the place. It brings, the budget is kind of looked at differently. You know, when you go to an agency, whatever, you know, DDS gives you money, this is how much it costs, blah, 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 blah. Where you're able to have more of a voice in terms of where does it make sense? And it's a little bit more flexible. And it really is unique to the person. And also it really focuses on the capacities, the goals, the strengths, preferences. And if you look at systems-centered planning, I mean, that's much more that the professionals are in control. You know, you basically get eligible for services because of your deficits. You know, and it's more on labels, and it's usually a placement in a program, and there's not as much choice. So that's the two ways of kind of looking at services. So this is the medallion for Charting the LifeCourse. And it really, if you notice that picture in the middle, is the person surrounded by a family, and also looking at life domains, safety and security, and healthy living, and meaningful day in employment. What I love about Charting the LifeCourse is that there's absolutely no jargon. And it basically, it's all the things in life you and I talk about. You know, like, what do we do during the day? Where do we work? You know, who do we hang out with? What do we do for fun? And that sort of thing. Where do we live? Who's their community? So this is in the booklet, and this is the LifeCourse trajectory worksheet. There's a few of them, but what I love is, you know, it's really basically about what do you want and what don't you want. I never used to ask people what they didn't want. I do that all the time now. And sometimes people can be, you know, you're really not sure about what you want. And so a lot of times it's much easier to list the things. Okay, this I definitely don't want, and you can go up from there. And so, you know, as you know, our lives, none of us have a straight line to getting everything we want. It kind of goes up and down a little bit. But this is kind of a wonderful graphic to take out and kind of look where you are, you know, to that what you want still makes sense, what you don't want. Have there been some experiences this year that have taken you more downward? Or are you focusing to continue to go up? Because when you think, you know, from our birth, it's all been steps along the way about bringing us to what a good life is. And then this is the integrated support star that Leo mentioned that's in the book. And if you notice, I know this is a little hard to read, but it starts with the person's strengths and their assets, and you know what is important, what do they do well, who are the relationships in their lives, and also on the other side of the star, what about technology? I think, you know, through this pandemic, we have all been really impressed with the abilities of people with disabilities to be able to access Chromebooks, Zoom, iPads, and that sort of thing, and how technology is a real important foundation in helping people to be as independent as possible. And then we really look at the community, where are they members? Do they access community? And then finally, the right-hand side is about supports and services. So it's not all about the supports and services. These other parts of the star are just really incredibly important to get people where they are and what they want to do. So that's pretty much what I had. You can get all of these life course tools by, in the tools book, there is the website, which is lifecoursetools.com. They're all free. And they have a nice web page. They have a parent perspective web page, and they also have person-centered. So because, it's not uncommon for families and the individuals to have different perspectives about what their future may look like. And it's just a wonderful way to kind of look at the differences and take into consideration what an individual may be saying and asking for, and what the parent may be looking at, and knowing, how do we compromise there, or how do we approach this, and how do we incorporate the individual voice as much as possible. So I will stop sharing and turn it over to Rosalie.
And Rosalie, let me know if at any point you want me to put up the book again. So.
Yeah, that'd be great. If you could put up the book, that'd be awesome.
Sure.
Thank
All
you
right.
very much. So first of all, I thank you so much for inviting me today. And I want to thank Leo for reaching out and asking me to work with the team at the ARC to develop this new book. Back when the original Tools for Tomorrow was out, I was executive director at Minuteman ARC. And if you can all think back, many of you I know were around, looking at Marjorie, shaking her head. Hi, Marjorie. We were in the middle of the Boulay lawsuit in the early 2000s, and we were attempting to place many individuals, 2,347, if I can remember correctly, across the state into residential services. And we really amped up family support across the state and said we need to work with families to help them work with their loved ones to identify their needs, their goals, their vision. And we use Tools for Tomorrow as a basic tool. And I know at Minuteman ARC, we used to run Saturday day-long sessions. Terry Varney and John Thomas and others would come out and facilitate group meetings with families and their loved ones to really sit down and do person-centered planning. So for me, I actually, even after I left Minuteman ARC, I still have my tools book, which was just a basic guide to say to families, this is not hard work. This is really sitting down and having a conversation, and let us help you structure that conversation so you can make sure that this is your vision and your loved one's vision and the individual's vision driving the services and choices for services. It's not dissimilar from what we do when we first have families in early intervention, and we say, by the way, you are the key service coordinator for your child. It's your family's vision and goals. So when Leo approached me and asked can we revise Tools for Tomorrow, because we really wanted to respect the legacy of the families and individuals who developed this tool so long ago now, that we also discussed the fact that now we do have a nice, very usable, very approachable structure in Charting the LifeCourse. And Charting the LifeCourse gives us some very simple but elegant tools on how to really look at the vision of the individual. As Kerry said, what do you want and what don't you want? What do you know based on your experience that you just don't want anymore in your life? And you're going to build your trajectory of your life, be it for 6 months, a year, 3 years, 5 years, you know, you set your goals and how do you get there? And then one of the most important tools, I think, is the multiple variations on that integrated support star. And Leo, if we could just scroll, can you scroll down to
Sure.
so there's the trajectory. Now here you can read this a little bit better, Beth, and you'll be able to read it. I saw you said it was small on the other one. You know, these are the various areas in the integrated support star, but you lead with what's on top, the personal strengths and assets of the individual, and how you identify what those strengths and assets are. And then you move from there to say, okay, what do we need to put together to have a full and meaningful life? Be it your whole life, or maybe you may be talking about one specific service. You may just be talking about what you're doing during the day, Monday through Friday, for day services, or you may be talking about residential, or you may look at the whole thing and divide it down. What we've tried to do here in this tool, in this very brief guide, is take you through how you can do that very simply, and how you can help guide your loved one, or individuals can read this if they have the, and look at this and say, how do we go through this process of identifying what services and supports will support my vision? You'll notice that eligibility specific is down in the far right corner, because that should not drive the vision. It is a cornerstone, but it's not going to drive everything, because we want you to really look at what else is available in the community. Your relationships are key, and all the community-based supports that could be available. So really, retooling or redoing Tools for Tomorrow was just at the right time, as we've been working closer with Charting the LifeCourse. And in addition, as DDS service coordinators are being trained in Charting the LifeCourse, I know a lot of provider agencies are also using it, family support centers, so we can all be speaking the same language and moving along. So hopefully this will be for all individuals and their families and guardians and those who care for them or help support them, a tool that they can have a booklet. This will be printed, but in addition, they can go online and use these. And we, as I mentioned, we really did work very closely with Charting the LifeCourse. They reviewed this, and they know that we have given them links throughout this document, if you go online, to all of their resources. And so hopefully this will be an interactive kind of tool that people can use. So much different than 2000 to the 2000 version in that way, in that we can use it in multiple different ways and rely on technology. So if you just scroll down a little bit more, Leo, and I wanted to just talk, see here, so we give you, if you just go up one, we're giving you a blank star so you can see that. This will be, you can go online and reproduce this and just have the star that you can either type on or you can write on, the same with the trajectory. So hopefully that'll be very useful for you as well. So then if you just continue, I just wanted to guide people. So we also wanted to make sure that people were aware of some of the philosophy and approach to around this type of planning. And the key is the individual is the star. And is really, everything should be around the individual, but that the individual also has a team that works with them. So we wanted to point to some of the key players. You know, you talk, networking is critical. As all of you who are on this webinar know, you work with people, you learn from people, we all learn from each other. And the more people you talk with, the more ideas you have, the more you can think about how other people made their lives meaningful. And but of course, and I know many of you who are on this call are connected with family support centers, autism support centers, Mass Advocates Standing Strong. These are agencies, in addition to the ARCs, who can really help support you as far as giving you ideas about how other people have developed plans. And we also, because we wanted to make this a small booklet, we have talked about the fact that people do self-direct their supports. Now, we didn't do a full long overview around self-direction because the ARC has already developed that. Diane Huggin is on the call here today, and she led with the Mass 21 group, the group that developed resources on self-direction. So instead, we're giving you links because we wanted this to be not an overwhelming document, something that you could really just point people to the other resources. So, and we do feel the self-direction is very important around people's services. So it's something I want you should be looking at. The other thing we wanted to give you was this tool that is on the screen right now. Whoops, one back. There you go, which is finding providers who support your vision. As a former provider and state agency lead, I think that is critical, where people come in and realize they are, remember we used to use consumer all the time, but they are the customer. And you have the right to ask about what they can provide. Sharing your vision with a service coordinator is critical. And then having the service coordinator make referrals to agencies that would share your vision. We know that's really hard. It doesn't always work because there's not as much available, especially right now. But at the same time, keeping your vision paramount. And in conversations with providers, and Kerry, do you have that individual sheet? Can you pop it up? If not, that's okay.
I can pop it up too.
Okay, the individual sheet.
Yeah,
We
actually,
wanted to do this as a standalone list for you, just to get you started around conversations with providers. So often families will think, okay, well, I got this referral. Now I'm just going to go. I want to look at this program. This is what their day schedule looks like. But we really tried to reorient this for you in that it's first, talk about your vision. And when you meet a provider, this is what I'm looking for in a program, be it a day program, a residential program. Day Hab is also, I mean, this is not just DDS programs, but really talking about what is important to you. And then asking providers for examples of how do they do something, how do they provide services that would support that vision. Talking about staff training and how staff become educated around the individual's vision is critical. So there's a whole list here just to get you started on this process of really having a more personal conversation with providers when you interview them. I think people frequently think, oh, they just walk through a program with the service coordinator, see some people doing things, but really having an opportunity, and this is your right to do this, to sit down and ask very specific questions and have a dialogue around whether or not a program really fits what the individual wants for their day or for their living setting. So, you know, it's just really starting to instigate that kind of conversation. The other thing that we just wanted to mention to people is that if you just go a little further, as that we wanted to set the scene for, this is when you create a vision, it's not forever. And life changes, visions change. And so this is a tool that you can be as dynamic as the individual for whom the planning is happening. But sometimes things don't work. And who do you reach out to? And well, hopefully we have given you a number of resources here. Obviously, as we talked about networking at the beginning, with family support centers and autism support centers, Brain Injury Association, Mass Advocates. There are also, you can use these as your supports if something changes or if there's a problem. And obviously also, here's my plug, support brokers at ARC Mass are always available and are knowledgeable about how to navigate the system of services. And we've given you a lot of resources that will lead to other resources. There's a resource page, and all of them, if you go online, are hyperlinked for you. So it doesn't look hyperlinked on this version because this is a print version, but on the online version, it'll all be hyperlinked. So then that opens up the world of resources for you. And then the last thing is really, as the ARC of Massachusetts, we advocate for change. And as Kerry mentioned, and Leo always mentions, they want to hear what's working, what's not working, because that's, as all of you on the call, because I can see the group of people on the call are all family leaders and professional leaders in the field. You know that if we don't voice our concerns about what's happening or good things that have happened, we are not going to be able to continue to help this system of services change and grow to meet the needs of those we serve. So hopefully this is going to be a very useful tool. I'd love to see it dog-eared and, in people's backpacks, where they can really come to an ISP meeting and say, I looked at this, here's my star. And this is what we tell people, bring your star, bring your trajectory to an ISP meeting and share it. Have that be the focus of your vision for your ISP rather than the standard, it looks the same every year. And as a parent, I'll say that. I always make sure my son's ISP vision changes. So that's
Thank you.
for me. Thank you.
Rosalie, awesome. Kerry, awesome. So just one of the things I want to amplify. So some folks that are using the supports and doing self-direction and combining traditional services with their self-direction, they're doing great. In fact, during the crisis, those that felt they had something in place that worked did better, actually, because they were less worried about so many people in the house. The flip side, though, is I don't think our system is, how would I say it, retail oriented, right? It's really structured around a provider system. And so therefore, the same kinds of barriers providers might face in negotiating, you may face as a person with a disability or a family. Okay, and that's not bad or good. It's just the reality of a transitional period. We haven't yet figured out, I think, a sweet spot of how the system can be structured, not structured, but more or less having the tools for people in the government side of it to make things flow as easy as possible, or not, if it's not easy, more functionally, okay? And so that's something where the feedback that Rosalie referenced is really helpful and important. And obviously things are never going to be perfect, but you want them to be satisfying, a good life. So that's really important. So I want to say we're actually, we literally have just a couple of minutes. I know there's still a question hanging out there, Kerry, that Diane asked about, is there a resource available for services beyond traditional services? And I guess that would mean the SQUAL services that people might be able to get, looking at the whole array at Mass Health. SQUAL is, it's qualified services that people can get that are more individualized, right? That are in the family support. If you didn't have residential and you were getting family support at one time, you probably know what I'm talking about. They would offer you respite, or they would offer you, peer support. I think that's rarely offered, but I think MASS has a bunch of peer support, right, options that they can bill for. But there's a whole menu And I don't have the link right here. It may be in the book, SQL. I can't remember, Kerry, if that went in, or Rosalie.
I don't know if the SQL directly
guess
went
it
in the
did.
book. It didn't, but certainly that's something that service coordinators can connect people with if
Yeah.
it makes sense as far as individualized services.
Yeah.
Yeah.
So I just wanted to add too that, nobody gives you a menu. When you go into DDS or a provider agency, they give you a menu. These are all the different types of services you can get. And you're like, oh, well, a little bit of social skills, a little recreation, a little respite, that sort of thing. So I always encourage people to have that voice and to be prepared. You know your loved one's best. What's important? How are they best supported? What's a good day look like? What don't you want? And have that to begin the conversation instead of what can I get? And because they'll come back to you and say, well, what do you need? So it's, so the trajectory and the integrated support star, and just really being able to answer all those questions of what makes a good day. Yeah.
And it really reorients it. And that's what I think one of our biggest hopes around this new tools for tomorrow version is that it really reorients the conversation. When I was an executive director, my staff would take people for tours. All the conversation is primarily around, this is our CBDS program. Let's use that as an example or whatever. This is what we do. Yes, there's time to say, so how are you? What are you doing? What's your day look like? Where were you before? But they're not really asking, what's your vision? What do you want in the future? So as families or caregivers or whoever, we need to help get that voice out there. And really, and in working with families, I now work as a support broker for the ARC. This is one of the things that I say to the families and the individuals. You start it with your vision around what you want for services, rather than, okay, you have to be in day-hab now. I mean, that doesn't do anything. So it really is changing the conversation. It's turning it around and focusing on the individual.
Okay, anybody got a quick question before we say have a great afternoon and see you? Well, next week's Memorial Day, so we will not see you Memorial Day. But we will, the week after that is a housing, special on housing with people from Still, and Abundant Housing, which I should have known the organization, but I didn't. I know CHAPA and I know others like that, but it's all about some of the issues, the intersecting issues between our community and people in maybe urban and rural areas, economically disadvantaged people who are having a hell of a time getting housing and whatever. So, and I just, Diane got on a little later. She might not have heard me mention her name, but she was the one nudging, saying that booklet, should be redone. And so when Jim and Tina talked about memorializing Alec, I said, well, I have a great idea for you, that we could do. And it's so that put it into place. So this is a community. We're a community together. And it's so special, and really appreciate it. And just appreciate all of you, what you do all the time. And good to see you, Marjorie, and others that are here today.
Hey, Marjorie.
Hi.
Yeah, and Kathy, and so many of you that are like totally trying to keep things on course. And we've had a hell of a year. And so thank you, everybody, for being with us. Have a great week. Have a great 2 weeks. And we'll see you on the other side on June 7th. Take care and God bless.
Bye-bye.